we're going to now continue on the theme of cognitive issues related to cancer treatment. And I'd like to invite Julie Hicks up. So Julie is a speech pathologist, and so Julie's going to talk a little bit more about the symptoms that you may experience, but also what kinds of treatments we do have available while we're waiting for these medical options to become available.
Hi, good morning, everyone. I do have one joke. I hope this helps me out a little bit. Where do neuroscientists go to study? The hippocampus. Not too bad, right? All right. So my objectives here today, as Heather so nicely described, are to take what Dr. M started and bring the idea of cognitive therapy into the perspective of how can we help you while we're waiting for these other medical treatments. So I'm hoping to give a brief overview of cognition and what we know about cancer treatment and cognitive changes. I'll go more quickly through those slides since we already got a nice overview of that, as well as the symptoms that may occur, but more in particular about how we might go about evaluating these changes, and then talking about what strategies and therapeutic activities could be helpful for someone. So what is cognition? I actually get asked this a lot in my speech pathology sessions with patients. Because cognition is actually better to think of as an umbrella term. And it's this mental action or process of how we acquire knowledge and then how we understand knowledge through our thoughts, our experiences, and any of our senses. I like to break down cognition into 6 domains, and even some of these domains you can break down even further. But we like to think of them as attention and concentration, how you focus and multitask, executive function skills. I like to think of these as the executive secretary skills. They're very high-level functions that help you plan, organize, prioritize. Anything you would want your personal secretary to do for you that you can't do, that's executive functioning skills. Information processing, so how we take information, the speed at which we understand it and know what to do with it. Visuospatial skills. So this is how we interpret what we see around us. Language skills. So this could be finding words, but also understanding words, whether that's the primary language you speak or a new language that you're learning. And then lastly, learning and memory. So memory for things that we already know, and then how we remember new things that we want to know. Now, the next couple slides are summative, a little bit you already got from Dr. M, but what do we know so far about cognition and cancer from the literature body of research? Well, we know that it's actually quite common. I think most of the research studies I was looking at were suggesting that up to 70% of men and women who undergo cancer treatment are going to experience a cognitive symptom at some point. And it's one of the most frequently described symptoms amongst all of the other physical symptoms that you might have. Because if you think about it, cognition is part of every day. We like to talk, we like to think, we like to work. All of these things involve cognition. And they can be present during your treatment period as well as the post-treatment period. Cognitive changes don't discriminate. So our body of literature suggests that the side effects could be seen across many different types of cancers, head and neck cancer, breast cancer, all the different body parts. And then it also doesn't really matter necessarily what type of cancer treatment you're getting. Dr. M was great talking about changes that we see in people who are getting immunotherapy treatment, radiation treatment, chemotherapy. So that term of chemo brain, it's not just chemo brain. You may still have these problems even if you did not get chemo treatment for your cancer. It's also complicated to study, and this pertains nicely to the question we had from the audience about the fact that multimodality treatment, meaning most people aren't just getting one thing to treat their cancer these days. You're usually getting more than one, sometimes at the same time, sometimes sequentially. That makes it really hard for us to pinpoint which one is the exact cause. Now we know that radiation is certainly getting better. It can be more targeted, so maybe that could be something that's contributing a little bit less, but it's really hard to know. And I honestly tell my patients, it's better not to focus on pinpointing which one is. Let's just focus on helping you get better. We do know that there are certain risk factors that may make someone more likely to have cognitive complaints before they undergo cancer treatment. This could be something like a pre-existing illness. It could be your age. So obviously someone who has a more advanced age may already have cognitive changes related to age before they go into their treatment. If you are more of a frail individual going into your cancer, you might have more difficulties. Any prior use of alcohol and drugs could impact your cognitive function before you go into treatment. Mental health problems like depression and anxiety, your hormone and menopause status, a higher stage of disease or disease burden. So if you have like a stage 4 cancer, you may have more difficulties than someone who was caught earlier on. And several other things that I just was not going to keep listing, otherwise this slide would be very full. We do know that timing also plays a role. Many patients are reporting improvement in their cognitive function following the end of their primary treatment. I think most people and most studies are saying about 2 to 4 months after they start seeing some resolution. But for others, remembering everybody is different, it could be gradual. It could be up to 1 or 2 years. The most common complaints that I hear are things about attention. So I don't multitask well. I have to focus on one thing at a time. Otherwise, I'm not going to get it done efficiently or accurately. I don't concentrate well, especially when I'm on the computer. I really just can't focus and get my work done. I have memory lapses and I'm forgetful. I don't know where I put my wallet. I don't remember what my wife just told me to do, and now she's going to be really mad. I don't follow instructions well unless someone writes it down for me. Maybe I don't handle some of my activities of daily living very well, so that could be my finances. I might feel like my thinking is kind of disorganized, or the kinds of behaviors that I would normally do aren't quite right. I don't have the same initiative or motivation to do these cognitive activities like my work or like getting my taxes done. And then I might have trouble finding words, and these could be just the everyday words like, oh yeah, I'm kind of hungry. I want that thing right there. What's that Yoplait thing? Oh yeah, the yogurt, right? Or it could be just a proper noun. So memory for somebody's name or a place that you went on vacation. These all fall within the realm of cognitive changes. Now, how do we test for these? I like to break it down into 2 bits. We have the cognitive screening and then formal testing. So cognitive screenings, there are a couple of different options. 2 of these are pretty common. One is called the Mini Mental State Exam, and the other is called the Montreal Cognitive Assessment. So these are things that physicians and physician teams will sometimes do. They usually take about 2 minutes or so, just to kind of get a brief understanding of where someone is at amongst all these different cognitive functions. And you usually get an objective score. And if you meet a certain score or are above it, we say, okay, you're pretty okay. Let's just kind of see how things are going. But if your score is looking a little bit below or later, then we might want to pursue something like formal testing. But we also really appreciate that 3rd item on there, which is a patient-reported outcome. And you can think of that like a survey where we're actually asking you, how much does this thing interfere with your life? So you might have a statement that says, I'm forgetful, or I can't talk to someone in a really fast-paced environment. And then you would have to rate like, oh yeah, that interferes with my life a lot, or maybe just a little bit. Those mean a lot for us too. And then in terms of formal testing, you might be asked to do something that's more like a 3 to 4 hour battery of testing. And this is often done by a neuropsychologist, but you might also get a specialized focused testing session with someone like me, a speech language pathologist, or even one of my colleagues in occupational therapy, where maybe we focus on one of these domains that you're having trouble with and really go in depth into see how much difficulty you're having from an objective standpoint. And you're going to hear me say things like objective, meaning the scores tell me so, and subjective, which is you tell me so. And I care about both equally. And on many occasions, I care more about what you think than what the numbers tell me, because I have lots of patients where the numbers aren't telling me how much trouble you're having. And so that actually helps me talk about this slide very nicely, which is performance on these tests doesn't always reflect the degree of your complaint severity. Many patients, including men and women with cancer, can often score within the normal range. And the normal range means the range of people that match your age, your IQ, your educational level, despite all the concerns that you have. Now, the research is telling us that there could be other factors that are influencing the amount of cognitive problems that you foresee. And I am not telling you this because I doubt any of the complaints that you have, but I really want you to know that stress and fatigue and anxiety and depression and not sleeping and the trauma of what you're going through with your cancer treatment, they really do have a big impact on your cognition too. And if some of these things were to de-escalate, you'd probably doing a lot better, okay? I like to think of all these things, especially stress. They are like tabs on a computer or tabs open on your cell phone. The more tabs that you have open, the slower your computer is going to run. You're going to see that little timer just going back and forth, telling you that it's still waiting to download, waiting for the web page to come up. Yep, stress takes up a lot of resources in our brain, and if we can close the tabs, it's really helpful. The nice thing, though, that we know is that there are some imaging studies to suggest that cancer patients are especially good at employing compensatory activation of other regions in our brain to help us maintain better performance levels. So sometimes we call this cognitive reserve, meaning you've already got a lot of good brain function in you to help you out, even though one area isn't doing as well as the other, but knowing that lots of parts of your brain help the other areas out. So this is really, really encouraging information. So you're wondering, what do we do about this? I am happy to talk about that next. We don't have a firmly established protocol about exactly what way we can manage cognitive impairments based on evidence-based intervention. That's okay. We are finding some promise in the idea of proactive approaches, and proactive approaches that include education, cognitive rehabilitation, and I will break that one down further, exercise and physical activity, and psychosocial interventions. So let's talk about education. Just knowing about normal, healthy brain functioning is a big step in the right direction. I want everyone to know how their brain works before we even talk about how your brain may not be working so well. I want you to love your brain and know how strong it is. Even if it's not working well, it's a good brain. Knowing what changes to expect, I think, is really reassuring and empowering so that you don't feel that you're abnormal and something is wrong with you. These are all things that can happen, and the trajectory suggests that they're all going to get better. Knowing that they're going to affect your daily life, I think, is also important too, especially if you're someone who's working, And even if you're not working, you still have a life. You still have a lot of things you want to do. And maybe some of those things need to be put on hold for a little bit, but we'll get back to them or get back to them in a new way. Balance. Balance of information is key. As a healthcare provider, I try to very specifically balance the timing and the load of information that I give a patient. You get so much information. Some days I know the patient is hearing what I say, and it's like a Snoopy episode. It's just going out the other ear. They're not ready to hear it from me yet. Maybe a week later, maybe 2 weeks later, bit by bit, that's how I'm going to give you the information. I'm never withholding. I'm just trying to help balance it out. But I want you to do this with yourselves too. The internet it's like a Mary Poppins bag. It keeps going. Some information there is good. Some of it's not so good. So please, as you try to consume information on your own, really balance out how much you're looking at a time. I don't want anyone to be overwhelmed or overburdened, and I don't want you to be primed to think that something is going to happen to you when it may not. Okay? Let's take things one thing at a time. So let's get into cognitive rehabilitation. I have 2 slides here. So one of them is going to talk about compensatory training, and then the next slides are going to talk about the activities that can help. When I say compensatory training, I mean learning new behaviors, new strategies to help you adapt to the change, to help you cope with the change. The reality is, you're going to be foggy for a period of time. We have to accept that. We have to adapt. Again, we're hopeful that it's going to get better, but we need to make some changes sometimes. So, my favorite one, modify your environment. Clutter. If you've got a cluttered desk, guess what? Of course you're not going to find anything. I really want people to help clearly label things in their house, storage, signage. It's going to help you find it. My favorite saying, don't put it down, put it away. Don't just put your keys down, put the keys in the key bowl. My fiance couldn't find his wallet this morning. You want to know why? He didn't put it in the bowl. He never puts it in the bowl. He is perpetually searching for his wallet. Everything has a place. Put it in its place, and guess what? You'll probably find it. This sounds really strict and rigid, but it's actually very helpful. It leads to this one, structure and organization. Your brain is like your chest. It needs a good bra to support it. We support it with things like external aids. Those are your calendars, your lists, your pill boxes, your alarms, your journals, your apps. Whether you're old school and you want it on a piece of paper or in a book, or you like it on your phone or your computer, I don't care. Pick one. Stick with it. It's going to be really helpful. Same thing. Create routines and try to stick with them. We, of course, have to be flexible. Things change, appointments change, but you'll find that routines are really helpful. There are also some other coping strategies that can be helpful. One of them I like to talk about is pacing. My rule is 25 minutes on, 5 minutes off. Let's talk about the taxes. Work for 25 minutes, then an alarm should ring and tell you to take a 5-minute break. 5-minute break, go wash your hands, water your plants, dry some dishes, move your laundry, something else. You'll come back, your brain will be much happier. Break down these larger tasks into smaller chunks. Try and minimize distractions. Distractions are your TV, your phone, the radio. Children and grandchildren, we love them, but they're distractions too. Let's talk about cognitive training. This is using repetitive activities that should hopefully increase in challenge level to help you improve, maintain, or restore function. These can be done by yourself in the home setting, or you can do them with a trained professional like me in a therapy session, whichever you prefer. But something that's really important here is you need to understand task specificity. This is key when picking what exercise you want to do. A memory exercise trains memory. Sudoku doesn't train memory. That's numbers. Yeah, you kind of have to remember where you put something, but you wrote it down. Not really a memory exercise. You want to improve your language function? because you have trouble finding your words, you need to do a task that makes you find words. Consistency is the other key thing. It's critical if you want a good outcome. That means a little bit of practice every day. Don't do binges 1 to 2 times a week. You should be doing more like 20 to 30 minutes a day, a couple times a week. Whenever I assign people homework, I'll be like, how did it go? Did you do a little bit every day? The answer is always no. They did it the day before they came. Okay, that's fine. I'm not mad, but you're not going to get better. Apps and web-based programs are really popular. These are nice. They offer a variety. The software adapts to your performance. You can access them anywhere, your couch, the waiting room. You don't need anything else, but they can be expensive and they don't always generalize to the task that you care about. But if you want some recommendations, I like Constant Therapy, I like Brain HQ, Elevate, and then I put Lumosity at the end. I love more things like non-tech activities. They're simpler, they don't use a device, they're based more on your activities. They're cost efficient, they're free. You don't have to fuss with technology, they're pretty realistic. But sometimes you need to do some pre-planning, and it's not always new and interesting. These are my favorite. Find some categories. Practice listing things in them. Find a word. Try and give me a synonym and an antonym. Let's say I want to describe someone as boring. I can't find that word. Well, I can say, he is not interesting. That's finding the opposite. But I could give a similar word like dull. He is so dull. Or if I really can't get it, I'm going to talk around it. He puts me to sleep. Okay? Find your word flexibility there. You can edit headlines. You can summarize articles or book chapters, write a description of a picture, sequence steps to your favorite tasks like making a cup of coffee, doing a load of whites in the laundry. Make your grocery list and try and learn it. Join a book club where you have to remember what you read and then talk about it to somebody. This is kind of leading to the games. They're not really tech games. They're more like board games or other games. I get asked about these a lot. They're fine. I like you to do them in conjunction with the other things that I said. But I just want you to realize what they're helping with. So just make sure you're picking something that's relevant to you. I know a lot of people are taking photos. Take your photo real quick. It's cool. I put it there for a reason. And I'll go back later and show them if you want to take a photo again. I gotta hurry. I'm running out of time. I'm also not a physical therapist. And I'm not a psychologist. But I want you to know that both of these things have really good impact on your cognition. We've got one study, the Hardman study, that shows that your processing speed can improve if you are doing an exercise program. It doesn't mean you're lifting big weights at the gym. You just might be walking and using little weights. The 1991 Simprint study showed that people who were just participating in attention-restoring activities, walking outside, tending to your plants, bird watching, caring for your pets, you're going to have better attention to other activities. And the Johns study, which is showing improved attention and working memory in patients who are participating in mindfulness programs, stress reduction programs. These are all meaningful, people. So my take-home message here, as I'm a little bit behind, are first, cancer survivors and those currently undergoing treatment. You may all experience, that should be experience instead of exercise, sorry about that, symptoms of cognitive change. The specific symptoms may vary person to person depending on your risk factors and circumstances about your disease and disease treatment. There are ways for us as your healthcare providers to screen and formally test your complaints. You can still perform well on a cognitive test, even if you're symptomatic, and we're still going to help you. Don't worry. Being educated and informed is really going to help empower you, make you feel like you can do something about it, like all those things I just said, and be reassured that you're not alone. Because like I said, this is common. And that's it. Any questions?
Have you done anything in terms of relating the individual help or other activities to improve yourself to careers? Meaning, are some careers more difficult to maintain after a bout with any of the aforementioned
Yeah. Yeah. I mean, I would say so. Each person I treat is different. I have people who certainly are in some very, very challenging careers, specifically here in the Bay Area, venture capitalist, coder, doctor. That does make my job more challenging, because the idea is you have to find those specific tasks. I don't always know what those are, but if I have a coder, I'm going to tell them, well, can you get one of those basic coding books, like Coding for Kids? Can you start there and practice that skill? Because based on the principle of task specificity, that's what we should start building up to, especially if you're too advanced for some of the very simpler things that start that groundwork. Then, yeah, we need to find something that really fits your job. So jobs that have a lot of high demands, you're right, it is a little bit harder for me to help them. I don't always have the materials, and the materials can be more complicated. Your employer might be a little more complicated to work on. Some things do have to change, though. If you worked in a really, really demanding position, we do have to usually get some letters of accommodation to your employer to get them to help you out. And we may have to change some things that you were doing at work. You might have had some really bad work behaviors, taking your work home, working way too many hours than you should, and you weren't billing for. Those have to change. Those really do have to change depending on the job that you have. Yeah.